Thank you, Acting Speaker. And it's interesting to rise after the Treasurer for Melbourne, who conveniently forgets just what his role is. Now, here we are in the state of Victoria that goes from Portland all the way to Orbost and Mildura down to Warrnambool and country towns all through. And what we've seen is a state that has the least funding per capita of our health system, that goes way back before the pandemic. Now, don't believe me. Have a look at the Product Commissioner's report that came out telling us. Now, we sat in our homes for much of the last 2 years, and for an hour at least a day, the Premier said to us he was preparing the health system. I'm sorry, but it hasn't been prepared. Today, we have a health system that is overwhelmed. We have over 100,000 people on waiting lists for urgent surgery, necessary surgery. And think for a minute about the person in pain that needs orthopaedic surgery, for example, a new knee, a new hip, shoulder operation, who's taking endone every single day, several times a day, worrying about how they're going to get rid of the addiction that they will have once they've had that surgery, but not knowing when that surgery will take place, not knowing when they get up in the morning whether they can put their foot to the floor and take steps capably. It's a most debilitating situation to be in, and to need that surgery and feel like you're going to fail and not be able to walk is frightening. Let's think about for a minute how many of those people there are. Over 100,000 people. Some of them are desperate for surgery for saving their lives, like someone who's found a lump in their breast. It's a very frightening experience, and the sooner you get that looked at— yes, it is. I've actually experienced it. I know firsthand how frightening it is. And when those results come back and you've got to have more surgery, it's very frightening. And what about the people who have been trying to ring 000? In my electorate, I am getting so many reports of this. It's just a failure on this government that there are less people answering the phone for 000 services today than there was prior to the pandemic. How can the Premier have said he was preparing our health system? And what amazes me the most is when I'm hearing, and I've heard this story more than once, in fact, at least 3 times in the last 3 weeks, that people are going to accident emergency with abdominal pain and being sent home. Now, I am going to state here and now that I can factually tell you it is not the nurses and doctors who are making mistakes here and sending people home. They have to prioritise based on the resources they've got. I see Steve, the member for Melton, shaking his head. Well, you think about the little girl who's 5 who was sent home and ended up with a burst appendix. Now, for those who don't know, the appendix is a part of your bowel. So when the appendix is inflamed and bursts, bowel contents can end up in the peritoneum. And it's not a pleasant situation. In fact, I've seen people die from that, and it's not uncommon for that to happen. I'm correct, aren't I, Steve? You know this too. Chair. And this little girl was so sick when she was finally operated on, they had to fly her to the Royal Children's in Melbourne. But you know what? The Royal Children said, we can't accept her. We've got 46 more urgent patients before her. This is not a Victoria that I can believe I'm in right now. This is not a Victoria where I can't call an ambulance and have confidence that the ambulance is going to turn up. You know, the emails we are receiving. And then you'd go to Portland Hospital. Now, last week in the parliament here, or the week before, I warned the government that young Jessa had contacted me, terrified she was going to have a baby on the side of the road. I spoke with her yesterday. That's exactly what happened. She had her baby on the side of the road. This is after the hospital had shut maternity services for 3 months. That happened after Portland Hospital had had their ophthalmologist taken away from that hospital, despite the fact that he wanted to keep practising, is capable of practising. There's no rationale Yeah, I know, actually. The member from Yan Yan's going, what's ophthalmology got to do with babies? That's right. So they've had ophthalmology cut, and despite the doctors all coming out saying something's really wrong here, and could you please listen to us because services are being cut, after the doctors came out and said that, they then cut maternity services. And guess what? At the public rally last week, people from the maternity services stood up and said, we can do this with a patient-assigned system. We don't need to shut this down. We don't want to lose our obstetrician gynaecologist, but if he doesn't have his ability to operate and do his gynae work, his obstetric work as well as gynae work, he's going to lose his skills. So, of course, he's going to be poached. They'll say the government will try and say it's because there wasn't enough midwives to fill every shift. Yes, but there's enough midwives to help Jessa and be patient assigned when she could have turned up and had her obstetrician and a midwife assigned to her to deliver that baby for her, rather than the terror she experienced on the side of the road. She talked about it. She had her hand on the baby's head as it crowned and she was trying to push it back in. That's what she told me, because she was so frightened of having that baby on the side of the road. Extraordinary situation. Her husband, Ben, can you imagine what it was like for him? Driving along, couldn't pull up anywhere because there's no overtaking lanes and it's a bloody shocking road, to be honest. It was dark. It was 5 o'clock in the morning when she delivered. The terror for that man. He knows that she's had a postpartum hemorrhage in the past, and that's why she contacted me. She said, I'm really scared. What happens if I have a baby on the side of the road? Thank God, thank you, God, that she didn't have that situation reoccur, because the situation wouldn't be that little beautiful Astrid is here today and Jess is in hospital, recovering, in shock still, I think. She was so in shock afterwards from having the birth in that such challenging way. But I just can't understand. The government are not listening to the people of Portland. I was sent with a message from the meeting and it said, immediately replace the current board with an eminent local administrator to work with the CEO and restore the hospital with a new funding model that properly reflects the cost of delivering health service that Portland needs and deserves. Cutting services isn't an option. The government have had the Hillis report that says Portland is in a situation where the ad hoc model isn't working. They need to put money and effort and incentives into attracting staff. Now, we did the perinatal inquiry in Parliament in 2018. The report was delivered, which recommended workforce planning that the government should do. It's now 2022. Where's the workforce planning? So 2 years, an internet ad for a midwife sits on the internet. No encouragement from the government to sort of, what can we do to incentivise? How can we do this better? And that's just not good enough for the government to say, I've given them extra $7 million. Don't be fooled by that, Portland community. Don't be fooled by that. That $7 million was to get through the pandemic and the cost of the outbreaks we had in Portland, where the hospital and the board 2 years ago did a fantastic job. The government have helicoptered in a chair from out of town, people from out of town, and put them all on that board. That's an insult to the local people to say there's no one in the town that's qualified or capable to be on the board.
Member for Bentley on a point of order.
Acting Speaker, the member has 1.5 minutes left, and in 8.5 minutes she has not actually spoken on the motion, which is about the federal budget. It isn't an opportunity to just rant about all sorts of things.
Your point is relevant?
Absolutely.
Members are entitled to respond to points that are made in debate. That's exactly what the member is doing. Member for South West Coast.
The people have told me that they've got no confidence in the board and they will not want to lose services. They need these services replaced. We can't afford to have people giving birth on the side of the road because the government hasn't funded the health service properly. The Hillis report was released 2 years ago, but not publicly. There's no coincidence that it was released after I raised it in the Parliament. The government can continue to pretend they're implementing it, but when you put in a board from out of town, I think there's a very clear intent that the government is not going to be producing a hospital that can give us the services we need. And when I get calls from people like John yesterday, who tells me he had a call from his the health service saying they can't give him podiatry any longer, I'm hearing more and more services being cut. He's a gentleman who's a diabetic with blisters on his feet. You should never cut a diabetic's toenails if you're not a podiatrist. What's going to end up with him? Is he going to lose his legs if he's not getting treatment properly? Why do Portland deserve less?